Hello, my name is Marta and I'm a counselling psychologist working at private therapy clinic. I would like to talk to you about my clinical work as well as about the therapy for eating disorder, which is the special area of my clinical expertise. I've been working for over a decade at the variety mental health services when I've been supporting adults and adolescents with different difficulties and various levels of severity. I hold a post at both NHS service and within the private work where I support young people and adults with eating disorders. In addition to that, I also lead a project supporting people from minorized communities, especially those from ethnic minority backgrounds, refugees and survivors of domestic abuse, in getting an early access to mental health support. Working in various environments and within the multicultural setting has enabled me to appreciate the complexities beyond just one individual problem and understand those problems in the wider context of social and cultural systems that individuals belong to. I have experience of offering psychological therapy for a range of difficulties, including mood disorders such as anxiety and depression, disrupted attachments, as well as issues around neurodiversity. My very special area of clinical expertise are the treatments for eating disorders, psychosomatic difficulties, which are the emotional expressions of psychological distress, as well as body image issues. In addition to my core training in clinical psychology, I completed trainings at the Division of Medicine of the University College London, Tavistock Clinic and the Research Centre for Treatment of Eating Disorders of the University of Oxford, where I trained in such approaches like psychodynamic psychotherapy, cognitive behavioral therapy and mentalization-based treatment. I'm also trained in the approaches specifically developed for the treatment of eating disorders. The breadth of the training and the variety of the training allows me to tailor my clinical approach to the individual needs of my clients. Now let me talk about eating disorders, which is one area of difficulty I support my client with. This will hopefully give you a little bit of an idea how I work. I really appreciate the different layers of one difficulty, so not only the symptoms, but also the underlying causes behind that. Eating disorders are the condition of body and mind when the emotional distress coexists with the bodily symptoms. There's no one single way of having an eating disorders. However, let's look at the most common symptoms of this difficulty. This would include preoccupation with one's body weight or shape or both, excessive dieting, and some of people would also employ compensatory behaviors once they lose control over what they eat. Eating disorders are complex and never have a single cause. We may think though about biological predispositions, certain social predispositions such as cultural, focus on superficial qualities like physical appearance, or associating certain qualities like being successful with certain body weight or shape. There are of course also psychological factors that may contribute to development of eating disorders, such as experience of certain adversity, loss, as well as core low self-esteem, clinical perfectionism, or low tolerance for uncertainty. It may be also helpful to think about eating disorders in more broader, dynamic terms, when the certain issues that cannot be resolved on the emotional level or even expressed through words somehow manifest themselves on the bodily level. So, for instance, if someone's personal identity is quite fragile, not well defined, and the interpersonal boundaries are not very flexible or blurred, then the individual may express significant distress and in a way try to regain the control over the situation and their lives by the way to trying to regain control by controlling the way how they eat or what they eat. Gaining insight on how eating disorders developed, including certain feelings, thoughts and behavior, can create the space when one can choose recovery. Once mental health professional assessed you and concluded that you have an eating disorder, you may wish to start a professional therapy which will help you to overcome your difficulties. The National Institute of Health and Care Excellence in England describes treatment proven to be helpful for those with eating disorders. And this includes family-based therapy, psychodynamic therapy, in particular focal dynamic psychotherapy, mantra, which is mostly model for treatment of anorexia nervosa, but also cognitive behavioral therapy for eating disorders. There are also other treatments that are helpful in the treatment of eating disorders, such as compassion-focused therapy for eating disorders and mentalization-based treatment for eating difficulties. Yes, I'm able to assess clients whether or not they have eating disorders and what type of the eating disorders they have. Sometimes they have more atypical form, and there's also treatment for that. It's also very important to identify the potential comorbidities. The most common are depression or anxiety, as well as assess the client's physical health. Especially in those more acute forms of eating disorders, you may also need help with that. In terms of therapy, I'm experiencing all the treatments that are recommended by NICE guidelines. And during the therapy, I may help you to explore which of these treatments, or maybe more than one, may be the most helpful to you. For instance, the cognitive behavioral therapy for eating disorders can bring you great relief with maintaining mechanism of your eating disorders, such as preoccupation with your body weight and shape, overeating and compensatory behaviors. This can bring you great relief and emotional space to explore the underlying causes behind eating disorders, with which can help you, for instance, psychodynamic psychotherapy. It is important to stress that regardless of some false narrative spread in society, within the right treatment, you can fully recover from eating disorders and move on with your life, having it much more fulfilling and no longer limited by eating disorders. If you struggle with eating disorder, mood disorder, please feel welcome to contact private therapy clinic and book your first session with me.